Okay. Well, good evening. Welcome to a discussion of gun violence prevention sponsored by the League of Women Voters of Colorado's Task Force on Gun Violence Prevention. I'm Rianda Osman. This evening, Dr. Emmy Betz of the University of Colorado School of Medicine will share with us some of the work that she's been doing in emergency medicine and firearm injury prevention. All right, we're recording this session, and the recording will be posted on the League's YouTube channel. Dr. Betz will have time to answer questions, and after she speaks, we'll have discussion time, so please put questions in the chat. Before we start, I would like to remind us all that the League of Women Voters is a grassroots organization that has worked since 1920 to improve local, state, and federal government and to engage all citizens in the decisions that impact their lives. The Colorado League was founded in 1928. The League neither supports nor opposes candidates or parties, but we do interact with elected leaders at all levels based on our positions on public policy issues. Our positions are formed after member research, study, and consensus. We are passionate advocates, both women and men, who work to influence public policy issues. And now I'm pleased to introduce Dr. Emmy Betz. She is an emergency medicine physician who trained at Yale University, Johns Hopkins, and a Harvard-affiliated residency. She is a professor of emergency medicine at the University of Colorado School of Medicine, where she is the founding director of the Firearm Injury Prevention Initiative. Dr. Betz promotes respectful, collaborative, science-based approaches for injury prevention with particular focus on firearm suicide prevention. She'll be discussing her journey and presenting data regarding gun violence. And so, Dr. Betz, welcome.
Great. Thank you so much for having me. Let me get my screen up. All right. Do you see the right view? Are we good?
I think we're good.
Okay, super. Let me just see. Are you still seeing it? I just moved it on my version. We're good? Okay.
We're good.
So thank you so much for having me. I really appreciate the opportunity to be here. I will tell you right now, I'm not here to talk about any specific gun laws, either for or against them. I'm going to talk about some of the perspective I have and that we have in the initiative on campus. And I think an approach of how to think about firearm injury or gun violence prevention as a public health issue, and how potentially we move away from viewing it just as a political issue. And I think that's incredibly important when we are forming our opinions about who we want to vote for, what kinds of policies we want to support. But this is not actually going to be a policy-focused talk. So I am an ER doctor. This is where I spend a lot of my time, in the University of Colorado Hospital. And I think when people think about gun violence in a hospital setting, it's often in this kind of context of our resuscitation room, where we care for the most critically ill patients. And I will tell you, I am sad and sick of seeing people being shot every time. It feels like such a preventable, an awful injury that really can wreck a person's life. And so I do speak from that perspective. But I actually spend probably more time working with patients with suicide risk. And that's going to be one of the themes today. When we think about firearm injury and gun violence, we need to be looking at the whole picture. So for me, in my daily job as an ER doctor, actually, I probably have a bigger potential impact on suicide prevention than other types of violence prevention, just based on what is most common. I am going to talk a little bit today too about some of the work that I've done that's been incredibly meaningful to me, working with the firearm community. One of the questions that was asked of me as I was preparing this was to talk a little bit about sort of how I got here. And what I would say is, so I'm actually a very proud Colorado native, grew up here, spent lots of time in the mountains, not a gun owner myself, but have many family members and friends who are. I also am a suicide loss survivor, as probably most people on the call are in some way, and have lost family members to firearm suicide. And I think because of that, I've long been interested in how could we prevent those injuries and deaths, particularly the suicides that don't get as much as attention it sometimes feels like. And really modeling the work of individuals in other states, I felt very compelled to work in a space working with firearm owners on interventions that are effective and are acceptable to prevent firearm injuries within their own communities. And that's where a lot of this work has come from, building up the Colorado Firearm Safety Coalition, research studies, and so forth, working with the firearm community. So I do a fair amount of education and teaching, which I love, and all kinds of things. So from teaching physicians around firearm injury prevention and how we should be talking with patients, to the ladies' night picture was probably my most nerve-wracking experience. It turned out to be wonderful, but I was very nervous going in. That was at a ladies' night at a local gun club to talk about suicide prevention with women who are very skilled and capable in shooting, but maybe didn't know as much about the suicide prevention piece. Gave a TED Talk in 2015, more specifically on the suicide piece, and have worked, the middle picture was working on a video for the New England Journal of Medicine. And I feel really passionate about spreading this message. And so one thing I would urge all of you to do is to think about, beyond just voting for or against certain candidates or certain things that you feel strongly about, how can you help spread the message? And by that, I mean, not engage in conversations that are yelling at someone or being yelled at, but how can we move to a space where we can really have engagement around these topics, that at the end of the day, we all want the same thing, which is that we all want to prevent these injuries and deaths. And how do we actually get to that space? So I encourage you to sort of lean into whatever roles you have in terms of fostering those conversations and spreading education. I think you're all here, so I don't need to talk about why do we need to think about firearm injury and firearm injury prevention in the United States. Particularly in Denver, I want to acknowledge that this year has been a particularly difficult one. You know, the shootings at East last spring and all of the discussions around school safety. I have kids in Denver public schools, and it's a time that is particularly for those of us who are parents or engaged with kids in some way, this feels like particularly stressful. But I also want us to take a step back and look at the bigger picture, because I think this is where you can also realize that the different ways that we can have impacts. So this is a chart showing who dies from firearms in the US. This is data from the CDC in 2010 to 2020. And what you can see is the solid color are, so the solid pieces are the number of deaths, and then the line is the death rate. And so what you can see is that there's a bigger chunk of blue. So deaths are higher among men than women. And I think that doesn't surprise anyone probably. And then you can see across the age group on the x-axis, the horizontal axis, you can see there's this big spike in young, sort of late teens to young adult men. But then there's a second hump in the sort of 50 to 54 age group. And then you can see that the rate increases in the later years for men. And that's predominantly from suicide. And so when we think about firearm injury, we think about gun violence, we need to be thinking about its many forms: suicide and domestic violence and mass shootings and school shootings, and how they are interrelated, but also distinct. In the US, about 86% of firearm deaths are among men. We also know that overall, 62% are among non-Hispanic white and 25% non-Hispanic Black. I apologize, these are very crude categories. This is what's in the CDC data. Obviously, it is far more nuanced. But we know that although the number of firearm deaths among non-white populations are lower, mostly because of the structure of the US population, which is still has a larger number of white individuals, the rate of firearm injury in young Black men in particular is at least 5 times high, and in some age groups much higher, to a level that is really unacceptable. And although I'm not going to do a deep dive into each type of firearm violence, I do want to emphasize that as you start to look into this, there are incredibly promising approaches for violence prevention. But what works in preventing youth violence, community violence.
Are we?
League of Women Voters, they're doing.
Oh, can everybody just mute? Thank you. But is that's different than what's going to work, for example, rural men at risk of suicide. And that's okay. We can do these hard things and we can find different approaches. So I alluded to some of this already. So when we think about firearm deaths total, this was data from 2020 from CDC. In the US, about 60% are suicide, 36% homicide. Far smaller numbers are the so-called accidental shootings among children, which are devastating, though, even if they are small in number, mass shootings and legal intervention. And I want to acknowledge that the coding of police-involved shootings is probably not accurate. And so that is probably underreported. But I think this is a little different than the way many of us perceive the issue. We spend a lot more time talking about, for example, school safety than thinking about youth suicide prevention. And yet we know more youth die every year from suicide than from a shooting within a school. Both are awful, and I'm not saying we should ignore one. But I do think it's important that we bring science to the table when we're thinking about things. And in Colorado, about 76% of all firearm deaths in our state are due to suicide. Again, even in Colorado, have disproportionately high rates of homicide among certain populations. So it's incredibly important that we're continuing to work in that space. But also, if we care about gun deaths in this state, then we need to be thinking about the suicide deaths. So I think the next question, I mean, I think I don't have to convince any of you that gun violence is a problem and firearm injury is a problem. I think the question is sort of, what do we do with that? And I think often the first reach is for getting involved politically, giving money to one side or the other, showing up at rallies and so forth. And I'm not trying to say that there's not value in that, but I hope you would agree with me that the conversations often feel so deadlocked at a political level that it can feel like nothing is changing. And what I hope to convince you of today is there's a lot that we are doing and a lot that you could be involved with or could support or could at least be thinking about that are ways forward, even if the politicians are deadlocked. So at the University of Colorado School of Medicine, I founded and lead the Firearm Injury Prevention Initiative. That you can see there's a QR code at the bottom if you're interested in learning more, and we do have a newsletter you can sign up for. And we really seek to use research, education, and collaboration to prevent all types of firearm related injuries and deaths, both in our homes, so suicide, domestic violence, unintentional shootings, and in our communities, community violence, school violence, mass shootings, and police-involved shootings. Because we really work from a space that we believe that no one wants these injuries and deaths to occur. And we recognize this common goal that everybody wants health and security. And we also deeply respect both diversity and consideration of a range of views, that we want everyone to have a seat at the table as long as they're willing to engage with us in learning and listening and respectful dialogue. And then perhaps most importantly, we believe deeply in engaging with impacted communities. So in some places that means working at gun shows to give out devices and talk with firearm owners. In other places that might mean working with youth at risk of community violence. And it takes a different approach depending on the issue we're talking about. So these are some of our core areas. Again, we're really seeking to build the scientific basis around research. We also do a lot of education, particularly in the medical community, but also with communities, policymakers. We don't advocate for policy, but we're happy to have conversations and provide evidence. And then again, perhaps most importantly, we seek to collaborate and really role model how those collaborations can work. So I just wanted to highlight a couple of the people working in our program, because I hope it will give you a sense of the kinds of things that are possible that are not solely policy based, but they are things that take funding. And so one thing to be thinking about is, as you're considering candidates, which are likely to support various initiatives that might fund the type of work that we're talking about, for example, whether it's through state funding, city funding, and so forth. So in the research space, we do a lot of work with different national funders for research, NIH, and so forth, at the Department of Defense. And these are just a few of the incredible folks who I'm lucky to get to work with. So Dr. Maya Haas, who some of you may know, she's a faculty researcher who's a pediatric emergency medicine physician who's looking at youth suicide prevention. How do we work with at-risk youth and their families to help prevent firearm suicide? In a very different but different lane is Laura Vargas, who's a physician in psychiatry who works with migrants from Latin America, looking at their history of violence, their PTSD, violence experiences, intimate partner violence, and risk of suicide. Chris Konopke is a faculty researcher who's a social worker by background, who's now working closely with the Attorney General's office to better understand the needs, the experiences, the perspectives of law enforcement officers as related to extreme risk protection orders. And this is an example where we feel it's really important to dig into the extreme risk protection order in Colorado. How is it being used? What are barriers to its use? Is it being misused? Is it being underused? All of those types of questions. And we're really grateful to be working with law enforcement and the Attorney General's office on this project. Ian Stanley is another up-and-coming researcher in our group. He's a psychologist by background, expert in PTSD, who's working in military communities around firearm suicide prevention. We also, as I mentioned, we really want to do a lot of education, and this is a space, if you have a need and you're interested, please reach out. We're always excited, and down at the bottom are just some of the places that we've been excited to do individual trainings or to start to build partnerships with them. Rachel Kennedy is a nurse researcher. She works with the forensic nursing program and with victims of domestic violence at our hospital. So she works both clinically, but also does a lot of teaching, education, as well as research in the space of intimate partner violence. Leslie Barnard is a soon-to-be Dr. Barnard, who is actually by background a champion sport shooter and now an epidemiologist. She's working with the state health department as well as with our group to understand the patterns of injuries, things like mass shootings, the use of extreme risk protection orders, and so forth. And she's helping build out a dashboard for the state so that it's easier for the public to look at trends in firearm-related outcomes, whether it's background checks or firearm deaths. And then Jeannie McCarthy, a soon-to-be doctor as well. She's a chaplain by background who's now doing incredible work in the city with various groups engaged in community violence prevention, particularly intervening with at-risk youth to help get them on a better trajectory. I'm going to skip over that for right now. And then I did want to just mention, we're really excited to be collaborating with different groups in informal partnerships, some of them listed below. If you are part of an organization and you want to be doing more in this space, we would love to talk with you. We do some technical assistance, particularly around distribution of firearm locking devices. We try to do a lot of outreach as well as connections across different groups. Matt Wettenkamp is one of our community outreach coordinators. He's a veteran, Marine Corps veteran by background, who leads all of our work with firearm owning communities in promoting particularly suicide prevention education. And then we've just hired Ray Gupta, who's a phenomenal sort of parallel to Matt, who's mostly focused on communities that experience high rates of community violence. And she's going to be helping build out our outreach programs on that side. We're really excited to be engaged in various debates. This was a panel after the East shootings. We really want to be an academic partner in this space and help provide science and data. So we're always happy to take questions on that front. And then one example of some shots from one of the events we went to, we've now given away almost 1,000 locking devices over the past year. And with each distribution, we have a brief kind of educational intervention for the individual so that we get the chance to educate them about risks of suicide and what does secure storage mean. And we do a couple different kinds of devices because we think that's important to give people choice. So I think the why is obvious, why we should be involved in this. I think for us, why we felt, why should we be doing this work? I think as healthcare providers, as researchers, as educators, we feel very strongly that we have a responsibility to be in this space, but to be doing it in what I would argue is the right way, meaning engaging with affected communities to find the solutions that are acceptable to them, that are going to be effective. And we really want to help be role modeling these kinds of collaborations in a way forward that is not about the yelling at each other or about just the politics, but about actually finding solutions that will help prevent the injuries and deaths that no one wants. These are our, again, the QR codes if you want to either subscribe for our newsletter or just learn more about us. And I would be happy to take any and all questions, and I appreciate the opportunity to speak to you tonight. Thank you.
Okay, thank you. We do have some questions in the chat.
Right.
Peter Gerfine of Giffords has given us a map. Peter, do you want to tell us what that map is about?
Happy to. We've done some research in Colorado and several states, in fact. And in Colorado, we've identified where the centers of gun suicides are throughout the state. And it turns out that gun suicide, although gun violence is often categorized as an urban issue, it's the rural areas in Colorado where the centers of firearm suicides are located.
Yeah, thank you for highlighting that. So, right. So when we think about, again, this is where you dig in, when you dig into gun, what does gun violence mean? When we think about community violence, it's often really clustered in urban areas. So the Denver metro area, Denver and Aurora areas have higher rates of interpersonal violence, often with youth. But right, when we think about then suicide, we know across the country and in Colorado that suicide rates are higher in rural areas as well as in mountain areas. Lots of reasons for that, probably including availability of mental health resources as well as willingness of people to seek mental health resources. And I think those two last things I mentioned are why it's so important that we also be getting education out to people through other methods. So we can't just wait till someone goes to see the doctor, because we know, unfortunately, that many people will never seek help, whether doctor, mental health professional, and so forth. So yes, so thank you for highlighting that.
Okay. Let's see. We have another question from Joanne Houghton Alico, who says, could you explain a little more about the extreme risk protection order?
Hmm.
Is that different from the basic protection order, if there is such a thing?
Yeah, great question. So there are protection orders for domestic violence that are a little bit different. Those are in the context specifically of domestic violence. An extreme risk protection order is a type of order that's specific to firearm access. So when an individual is at high risk of hurting themselves or someone else in the near future, someone can request the court prohibit that person from having guns. What it means in practice in Colorado, generally it's law enforcement who would request it. Family also can, as well as some other individuals in Colorado, so teachers and other people in some situations. But the idea is that they provide evidence that this person is an imminent risk. If the court agrees, then the person has to give up any firearms they currently have, and they can't buy any for at least 2 weeks, and then there's a full hearing. The idea is that it could be used to prevent things like mass shootings if someone is worried, potentially also suicide. I'll find a link and put it in the chat for people who want to learn more. I will just generally say, I think extreme risk protection order laws are very important. I will give you my own personal opinion. I think it's good that we have one because there are times when it makes sense. I also want to emphasize, though, particularly for suicide, we always want to be trying voluntary approaches first. So working with the individual who's at risk of suicide to lock up guns, make changes themselves before we kind of take legal steps.
Okay. Stephanie Greenberg, your hand's up.
Thank you. Emmy, I was just wondering, you showed a slide a few minutes ago about your group working with people at the Attorney General's office on training law enforcement in ERPO, the use of ERPOs. And with this new expanded law that was passed this last session in 2023, there are a number of other categories, and you've mentioned them. And I was just wondering what training opportunities are available for them, healthcare professionals, mental health professionals, teachers, so on.
Yeah, it's a great question. So we are focused on law enforcement because data from Colorado and elsewhere has shown that really, even when family are also allowed to request, generally law enforcement are the most common requesters. And so we felt like it was really important to do what we can to support making sure that officers are educated and aware of when and how to use the law and so forth. I think as a healthcare professional, I will just say I also have concerns actually about whether it makes sense for us to be reporting versus someone else. So we are not pursuing educational opportunities in that space right now. I think also just thinking about who are the most likely people to be requesting them. I think there are some scattered sort of efforts happening in that space. I'm not sure of any sort of statewide efforts, except with the exception that the new State Office of Gun Violence Prevention does have an education campaign specifically around ERPO awareness. I'll put the link in the chat. That is sort of out to the general public, but would include
Right.
and healthcare professionals or others.
Thank you.
Okay.
Oh, Beth,
Let's-
thank you for putting in some information there. And I think there are a couple other, I see a couple chat questions too that I'm happy to take.
Okay. Let's see. Virginia Mack has a long one here. We know that there are risk factors for firearm suicide, current depression symptoms, history of depression, and many others. I'm wondering if your initiative has looked at states who use licensure permit to purchase as a more comprehensive preventative approach on firearm suicide, particularly as an effective way to ensure screening is occurring to prevent individual who's struggling.
Yeah. And I know that, sorry, I didn't mean to cut you off. I was just reading the rest of the question. I was so excited to answer it.
Go right ahead.
But so right now that's not something we're actively looking at, honestly, because there are so many things to look at right now, and there's been so little funding for so long that we are trying to get up to speed. I think there are a couple. Your question is about sort of two things. So one is around like regulations on who can or can't buy a firearm or having licensing. And the second piece is sort of someone who self-recognizes they shouldn't own a firearm. There are actually some states that have voluntary do not sell lists basically now, where you can request to be listed in the NICS registry basically as someone who shouldn't be allowed to own one. So our group per se is not working on this right now, but there are others that are, and I would say there's the RAND data. RAND has a bunch of databases around firearm policies and their the evidence behind them in terms of whether they're effective or not and preventing various kinds of outcomes.
Okay. And Joanne asks, do you have a recommendation for a lock or safe device for a gun in a home and where best to find it?
Yeah, so I have lots of thoughts on this. And this is, I guess, Anne also had a question about offering gun safes for free to the public.
Yes.
So, if anyone is thinking of doing that, we're happy to provide some additional technical assistance and just give you some more details about how we go about it based on an effective program out of Washington. I think it makes sense to be more nuanced than just giving out cable locks, which are the simple and sort of cheapest locking devices, but many people don't want to use them. That's why we do a mix of lock boxes as well as lock boxes for your car that can be secured in the car. We do hand out cable locks as well, but we find people really like the choice and they take different things. It's a little more expensive, but we think it's worth it if people actually use the devices. Happy again to provide some of the educational materials too. We don't just hand things out. We do have this sort of structured, we ask people to fill out an anonymous questionnaire that has some knowledge questions specifically so we can then engage with them and hopefully educate them a little bit to prompt the behavior change, because we know, for example, people who believe that firearm access increases suicide risk are more likely to lock up guns at home. So I think, yes, there's benefit in making locking devices more broadly available to people. I think when it's done with education, it's even better. If you're interested in devices for yourself, I think certainly a local gun shop is a great place to go because they can help you walk through what makes sense for you, your lifestyle, your setup, and so forth. If you're looking for bulk devices that you can give away, please feel free to contact me and I can try to, not that we have lots to give away, but I can try to give you information. But if you do have an event that you'd like us to come to, we're happy always to consider that.
Okay. Well, I know that you have been working closely with gun dealers, and can you talk to us a little bit about the work that you do with them?
Yeah. So we do a lot of work with firearm ranges and retailers. But I will say we have meetings with people sort of across the spectrum in public health, across the political spectrum, because we want to engage with affected communities. Some of the work we're doing right now is working with firearm ranges and retailers in encouraging them, for example, to provide temporary voluntary storage of firearms, also to provide suicide prevention materials. The state actually runs the so-called gun shop project that involves educational materials, posters and brochures that they give out through gun shops. The whole idea is, as I alluded to earlier, there are many people who may not seek professional help. And so how do we get them the information from a place that they trust? And for some people, it may be their gun shop where they go practice at the range, and maybe seeing a poster or having a conversation about suicide prevention there might make the difference. So that's why when we think about getting these messages out, it's often about having the trusted messengers. And oftentimes that's not me. Like I recognize that if I'm going to go work with a bunch of ranchers in a rural part of the state, they're not going to trust me. But how can I then perhaps provide some education or technical assistance to the person who can get that out? And that's why we work with gun shops and ranges and firearm organizations. And if you're at all interested in that, please just contact me too. I know it can feel big and can be uncertain how to take a first step, but there are a lot of opportunities for involvement.
Okay. See, we have a new question from Roger Dodds. It says that I'm in Fort Collins and would like to see coordination between community contact agencies and database feedback on their diverse efforts. Do you know people at CSU who would work on gun violence prevention, or how we would develop resources in this direction? Preventative maintenance, as I just heard it called.
Yeah, I think I understand the sort of overall question. It may be a longer answer, so I please feel free to reach out to me. I do know some folks at CSU who are working in this space, although they're a little bit more in the suicide prevention, firearm suicide space. But yeah, I'll put my email in the chat if you want to just send me a message, and I can figure out how to get you to the right person.
Thank you, Dr. Betz.
Okay.
Constance, thank you. Not understanding how gun locks or safes could prevent suicide. Okay, thank you for asking this, and I kind of glossed over it. So when we think about suicide, we know that the sort of three key facts to know. So the first is that firearms are the most lethal method of suicide. About 90% of the time, if someone attempts suicide with a gun, they'll die. That should come as no surprise. But we also know that many suicide attempts occur after only a very brief period of consideration. It may be that the person has been struggling for a long time or depressed for a long time, but from studies of survivors, we know from the time someone decides to attempt suicide to actually taking action can be in the space of minutes to hours. So it's a pretty short time frame. That's where people sometimes call suicide impulsive. But the third key fact is that the majority of people, even who attempt suicide and survive, don't later die by suicide, meaning suicide is not inevitable. It is in fact preventable. And so one thing that is critical is making sure that a person who's in a high risk period, in a crisis, is in a safe environment, meaning doesn't have access to highly lethal things like firearms. So it's the same as having a designated driver. If you are impaired at a bar, it's a good idea for you not to drive home, right? For your friends to get you home safely. It doesn't mean you can't drive again, but it's about making sure someone in a high risk period doesn't have access. So secure storage at home, meaning locking firearms at home, certainly can prevent suicide among other family members. So anyone who doesn't have access to the gun, it can prevent, and particularly those teen suicides that we worry about. It's a little trickier for the firearm owner themselves because they presumably still have access. The hope is that even the time it takes to open the gun safe or open the lock may help change the mind of the person who is thinking about suicide. The other recommendation is that for someone who has suicide risk, that they change access to firearms. So they give the key to their spouse, they move the guns out of the home, and so forth. And it's not that one last important point, it's not that the presence of a gun makes someone suicidal. We know that, but people with guns in homes are not more or less prone to depression or to suicidality. It's that if they attempt suicide with a gun, there's no second chance. Thank you for that question.
Peter, did I see your hand up?
I think Dr. Betz covered. I was just going to note that we in Colorado do have the equivalent of an Ethan's law that requires that guns be secured in homes with children and teen suicide, especially. If the gun is secured by the gun owner before they leave home, the teen is not going to have ready access to it. And that's just another important factor.
Yeah, thank you. And Beth asked about data and suicide rates with guns not belonging to the attempter. So I think in adults, most often it's a gun from the home, either theirs or spouse's. And then in youth who die by suicide with a firearm, I think it's something like 80 to 90% are a parent's gun. So, most often it is a firearm from the family. Yeah. It's huge, and we don't talk about it enough. And look, I'm a parent. I don't want to think that my kids could ever be in that situation, but they can be. And it's I really feel like we as adults have a responsibility to do everything we can to keep our kids safe. And in the firearm space, a lot of that I think really needs to be focusing on suicide prevention, and how secure storage of firearms can help prevent those teen suicides.
Oof.
Yeah, light topic for the evening.
Yeah.
I do want to leave you, although not depressed, in that I do think there's incredible work happening every day. I come home energized. I get to work with smart and passionate people tackling this problem in all kinds of creative ways. And it can feel really demoralizing to see politicians just sort of having the same arguments over and over again. And I think it's I think there's a lot we can be doing together and a lot we can be doing in creative spaces. Karen just asked about the Rocky Mountain gun owners. It's actually someone on my team just recently, I think, had a conversation with him. We don't have a formal partnership with them yet. In the past, they weren't as engaged. I would welcome their engagement in these efforts. Again, I think this is about finding some common ground where people can work together to get the messages out to the people who need to hear it.
Well, there's more data. All right. Gifford's data on deaths by suicide seem to be clustered in South Central Colorado, Park Teller, Fremont. Is this likely due to socioeconomic or political factors, or to denser rural populations?
Yeah, good question. Probably a little bit of all of it. I mean, I think I haven't dug into the Gifford's data specifically, but suicide is a complicated mix of socioeconomic as well as political factors, meaning political factors like, is there support for mental health programming, for resources, for educating people around the availability of things like 988, the suicide hotline. We also know that upstream things like food, housing, jobs, all of those things are important in terms of both preventing youth violence as well as adult suicide. So I don't have a great answer for you, but those are exactly the kinds of questions we should be asking, because then that helps us find the solutions.
For data, I know that you work with the Office for Gun Violence Prevention and setting up their database and their clearinghouse for data. And every time, I go out looking for data, information, ways to, measure what it is we're talking about. It seems very confusing and very sporadically available. Where do you recommend that we look for good data, and what could we do to get better data?
Yeah, great question. So first off, it depends if you want state or national. If you want state data, so keep an eye on the Office of Gun Violence Prevention website, because we're really hoping the resource bank, all of those resources will hopefully be up very soon. And so hopefully this question will get easier. But CDPHE does currently have, the state health department has dashboards for both suicide and homicide separately that you can pull out firearm deaths. If you want national data, CDC has publicly available free data, as well as fact sheets and things on various issues. So that's usually where I would go for my data. I think then there are some of the big organizations have like policy fact sheets and things if you want to understand what laws are present in different states. And you asked, how do we get our funding? So with a lot of blood, sweat, and tears. No, so we have a mix. We do have some initial startup funding from the School of Medicine that won't last forever, but we're hoping it will continue to grow, and that we can find additional sources of support. So like our funding for going to gun shows, for outreach in communities with high rates of suicide or high rates of community violence, that's currently funded by the School of Medicine, but for a limited time. And then research funding mostly is from national organizations, NIH, NIJ, and the CDC, as well as there are some foundations that fund research as well.
Okay.
Yeah.
Will the new Federal Office of Gun Violence Prevention be a source for you later on?
Yeah, that is a great question. And we've had conversations with their leadership. I think I don't know whether funding specifically will come from them. We are hoping Colorado is getting some of the funding from the Bipartisan Safer Communities Act, and I hope that will be going towards some of the programs we know that are helpful, and I hope that we can help inform kind of where that money goes in terms of community funding. My hope is that the national office, the White House office, can also just help coordinate among states. There's lots of good work going on in other states as well.
Okay.
Yeah.
There are a couple more here. One is a recommendation of locking ammunition separately away from gun locking systems would help to provide a delay in efforts for suicide-prone individuals to get armed. Is that something you would recommend?
So the safest way to store firearms is unloaded and locked with the ammunition stored separately.
Okay.
That also is not acceptable for some individuals. So for some people who want a gun more easily accessible for personal protection, they may not be willing to store it unloaded, in which case then we would say certainly storing it locked is the second best. When we talk about these things, we really want people to adopt at least something to move towards the healthier behavior. So it's a very much a harm reduction approach. I think if we take too hard of a stance in terms of how people have to do it, some people just throw up their hands and are not going to listen anymore.
Okay.
And then educating the public about suicide prevention in senior populations. That is a fantastic question also. We know suicide rates are higher among older adult populations, particularly men. We do some work with the VA and the geriatric core there, as well as with the Multidisciplinary Center on Aging, which is at the CU campus. Especially trying to get information out to older adult communities, as well as to healthcare providers and service organizations. Because there's, I think, a lot of ageism still that we really need to be fighting against and recognizing that depression is unfortunately common and often undertreated in older adults. And I think there's a lot more that we need to be doing to support individuals as they age, so that they, for healthy aging, ideally aging in place, staying in their homes and so forth. And if you have other ideas, please let us know.
Okay. Well, I don't see any more questions, and you have just provided, lots of information, and I'm so pleased that, there's so many things that are happening in this field.
Yeah, and I will just say, I think here in Colorado, we should be really proud. We are, as a state, I think really a leader in the country in terms of what's happening, both the state funding for the Office of Gun Violence Prevention, as well as I would say, like, we're trying to really be the academic leader in this space too, and we really want to be a model for other states. So we just have to keep at it. And I'm putting some links up to a couple of the last questions, including around the gun storage map.
Okay. There's one thing that you could probably tell us really quickly. Where is the gun storage map located on your site?
Yeah, I just put it on the
Okay.
I just put it in the chat. Thanks
All
for
right.
asking. Yeah, thank you so much for having me.
Well, thank you very much for speaking with us and taking your time. I know it's valuable and what good work you're doing. Thank you.
Well, thank you all as well, and get out there and vote. Thank you.
Thank you. Thank you, everyone. There will be a recording of this on the League of Women Voters YouTube channel, and Dr. Betz has agreed to let us have her slides as well. So we will have those resources.
Great.
Thank you and good night.
Bye.